Exercise 23.1, number 3, is traumatic arthritis due to an old traumatic dislocation. Now, if you look at arthropathy, traumatic, ankle, you get an M code. We know this is an old injury, so an M code is correct. And there is your pathway. You're going to code the arthritis and you're going to code the dislocation of the ankle with the 5th character S for sequela right here, because it's an old injury. Sequela is the appropriate 7th character. Many times in coding this chapter, you're going to see notes in the alphabetic index that say C so-and-so. So you're kind of flipping back and forth, looking quite a bit. Once you've coded for a while, you know when you see something, just to skip that first main term and go straight to the second term because you've coded enough that you recognize that. In this case, it does not have a 7th character, but you're looking at a 6th character, and number 2 indicates it is the left ankle. Exercise 23.2, number 3. What's interesting here, and I wanted to bring this one as an example, the index, when you look up derangement of the knee, gives you an M code, and we know that can't be correct because it's a current injury. See right here, current, and therefore it has to be chapter 19, an S code. So if you look again, you do see that there's a subterm for current injury. You just don't see it right away. But when you find it, it gives you that S code. Actually, it says C dislocation. Again, you go to the next step, dislocation knee, and there you get it. 7th character A is your initial encounter, and the 6th character 4, in this case, is the right knee. The other thing I found I wanted to use this particular one, the code is not correct. It's one of those that gets you in the neighborhood, but not to the exact code. S83106 is an unspecified knee, and we know from the diagnostic statement it's a right knee. So we're going to look around our codes and find S83.104 indicates it's the right knee. And again, the 7th character is A. Exercise 23.4, number 3, is acute myelitis. In ICD-9, which many of you don't know, but there was an assumed linkage between osteomyelitis and diabetes. That is not true in ICD-10. So the old coders are having to get used to not looking at things the same way. Because it is a diabetic problem, the diabetes codes are going to go before the osteomyelitis code. And osteomyelitis is a complication. The answer key for the textbook, which I have, did not include this E11.69 code, but I think it needs to be there because this is only talking about the arthropathy. The fact that that person has osteomyelitis is significant. So I think that should be included. So that's why I included that E11.69 as the complication code for diabetes. In case you don't know, osteomyelitis is an infection of the bone, or an inflammation or infection of the bone, so it can be quite serious for someone who's not healing well. So that's why I think that needs to be included as your codes. Exercise 23.4, number 5, is a non-union fracture. So that's where you're going to use that 7th character K here for subsequent encounter non-union. Remember, subsequent encounter is when the patient is no longer receiving active treatment. They're in the routine healing phase, but in this case, the healing is not routine, and the patient's presenting with a non-union of that fracture. Exercise 23.4, number 12, I included a disc herniation and spondylosis with radiculopathy. Whenever you're coding the general population, you're going to code a lot of spondylosis, and many times your excludes 1 and excludes 2 instructional notes give you information about the types of spondylosis. Be sure you're following those very carefully. Be mindful that all the exercises we're covering in this PowerPoint do not address all the many guidelines that we have to use. Exam questions can relate to all the guidelines covered in the chapters planned for each week. Always follow the assignment schedule with regard to specific chapter assignments. Post any questions in discussion board along with the path that you use to try to solve this problem, and I can answer it so that everyone can share in our discussion. Thank you so much and have a good day.